Actually, under Tim Hudak government, as laid out in our platform called Change Book, we plan on spending $6.1 billion more on healthcare than we do today, which is similar to, I believe, the federal government announced this a couple of days ago. The difference we have, we see some changes being needed to get rid of the fraud. Does anybody in this room see a big change in healthcare over the last 8 years?
No.
Do you think that we've spent 60% more money today than we did 8 years ago?
No.
So that's a problem. You can dump a lot of money into it, but you got to be smart about it. You got to look at what matters to people. I would like to see some of the services taken and moved out of the centers, the large centers, and moved into places like Cornwall, Winchester, and Alexandria.
They have a system called pay your way to the front of the line. They have a system called pay your way to the front of the line. That's not the system that I want to go to. We've paid into the system. Each and every one of us here have paid into the system. That it's fundamental to us as human beings to care for our elderly, our aging population. When you have a $14 billion hole in your platform and you're spending 50% of that on healthcare, that's where they're going to cut, because that's where they've cut in the past. Make no mistake about it, there's a clear difference. There's a clear difference between where the Ontario Liberals are and where the other party is. And you especially see it in healthcare. And all you have to do is drive up McConnell to see that.
What's our plan about increasing public funding? There's one thing that is common in all the 4 questions so far, and it really is about money. I got here a loonie and a toonie. This looks like silver and gold, and this looks like gold. The problem with monopoly money, government fiat money, is that it's no good. People created money, not governments. Governments stole our freedom to create our own money. To find all the problems of government, they can't even control their budgets. They're putting us deeper into debt. Our grandchildren are going to have to be debt slaves just to pay the government money. Let the people control their own money. Let the people decide what to do with their money, and they will make better decisions than any of us politicians.
Well, I'd like to address this question by telling you the things that we will do in healthcare. We're going to cut emergency wait times in half. We're going to ensure that dollars are invested in frontline care. We're going to scrap the LHINs. We're going to stop forcing patients to pay more. We're going to meet the healthcare needs of an aging population. We're going to ensure that everybody is a family doctor. We're going to keep people healthy, and that's going to cost. But I told you before where we're going to get the money to do this, and we absolutely have to commit the dollars to it. Right now, the funding that's given to hospitals is less than, and healthcare generally, is less than the rate of inflation. So when I said earlier that our hospitals are being rationed, they truly are, and they're being constrained and constricted.